Hello, everyone. You're welcome to today's webinar titled My Saskatchewan Pregnancy All You Need to Know. My name is Tammy Akintilebo, and I'm the coordinator for the Perinatal and Infant Health Program here at the Saskatchewan Prevention Institute. I'll be presenting today's webinar alongside my colleague, Megan Clark. I'll allow her to introduce herself shortly. Before we get into today's webinar, I would like to share a little bit about what we do in the Perinatal and Infant Health Program. The goal of the Perinatal and Infant Health Program, like the name implies, is to provide evidence-based information on emerging topics related to perinatal and early infant health issues. Stakeholders that we provide such information to include health and allied health professionals and the general public as well. We do this through primary prevention strategies by providing evidence-based information and resources on different topics. For example, topics relating to chronic health issues like gestational diabetes, oral health, mental health and substance use in pregnancy, domestic violence in pregnancy, and also infant sleep practices, as well as sudden infant death syndrome are some of the topics that we cover. So our role basically will be to increase awareness on those topics so that women can make informed decisions throughout their pregnancy, throughout delivery, and even their child's infancy. So without further delay, I'll allow Megan to introduce herself and take us into the topic of the day.
Hello, everyone, and thank you, Tammy, for that. And thank you to everyone else for joining us today. As Tammy said, my name is Megan Clark, and I'm the Research and Evaluation Lead at the Saskatchewan Prevention Institute. We would like to acknowledge that we are on Treaty 6 territory and homeland of the Métis. And as Tammy mentioned, we'll be talking today about My Saskatchewan Pregnancy, a Saskatchewan-based app. So in this presentation, we will give you a brief history of how the app came to be and describe the process we used when developing the app to ensure that, first, we were addressing the needs of pregnant women in Saskatchewan, and second, that the information in the app is considered relevant and accurate by Saskatchewan prenatal care providers. Then we will describe for you all of the features of the app and go through how to navigate the app. And finally, we will talk about some questions that have been raised. So you might be asking, why develop a prenatal app for Saskatchewan? Well, the inspiration for this app came about through an ongoing process of what we call knowledge exchange. So that's an exchange of information between pregnant women, prenatal care providers, and the Saskatchewan Prevention Institute. So first, consultation with community identified the need for a one-stop shop of Saskatchewan-relevant prenatal information, particularly for women who live in challenging circumstances such as poverty, remote locations, experience low literacy, or stigma and discrimination. So in response to this need, the Prevention Institute created a web page with prenatal information. This online resource is called Your Pregnancy Month by Month and provides evidence-based prenatal information in an easy-to-read and use format. So this includes the use of plain language and providing the information in shorter segments with the ability to access more detailed information or external links to even more information if desired. And this web page can be found at the Prevention Institute website. We then conducted focus groups with women across the province, particularly those who live in challenging circumstances, and found that participants were very positive about the website. However, women raised the issue of access for a variety of reasons, including having limited Wi-Fi service and not having regular access to a computer. It was suggested that the information on the website should be made available in a variety of ways, including in the form of an app. Women said that they tend to use apps more than websites, particularly on their phones, and that they use their phones most frequently. They like the idea of having an app with a variety of features. So in response, we did a literature review looking at electronic ways of accessing health information and found that most Canadians are familiar with technology and have the required infrastructure and are enthusiastic smartphone users. In particular, in Saskatchewan, we learned that Saskatchewan had the second highest percentage of households in Canada with an active mobile phone, and that smartphones are the preferred method of receiving health information electronically. We then hosted a roundtable on prenatal technology with approximately 40 health and allied healthcare providers attending. We shared our findings, and the resulting discussion identified that there was a strong interest among attendees in a prenatal technology tool, such as an app with interactive features. So we made the decision to develop a prenatal app. We really had no idea what we were getting into. It was several years of lots of consultation and work went into it, but we are very pleased to be introducing to you the prenatal app today. So the first step, an advisory committee was created with representation from healthcare and service providers that interact with pregnant women regularly. The purpose of this committee was to help ensure that the app was useful and relevant for pregnant women in Saskatchewan. The committee was enthusiastic and responsive. They started by providing guidance on the content and features in the app, and they reviewed the content during development and met together to review an earlier version of the app, providing feedback on content, look, and functionality. The technology of the app was developed through a partnership with Dr. Nate Osgood, a professor of computer science at the University of Saskatchewan. A graduate student working with Dr. Osgood, Iman Jamali, was contracted to develop the app technology with Dr. Osgood's supervision. A process called agile development was used, in which the functionality and appearance of the app was shaped through ongoing consultation and feedback as the features were created. It is important to note that although existing prenatal apps were used as an inspiration for this app, most existing prenatal apps receive ongoing funding through in-app purchases, whereas My Saskatchewan Pregnancy is free and nonprofit. This means that we needed to be very thoughtful about what features were included. Prior to release of the app, beta testing was done in which a group of computer science students intensively reviewed the app for bugs and glitches. Once those bugs and glitches that had been identified were addressed, we were able to do focus testing of the app with pregnant women, primarily from the target audience of women living in conditions of risk. For these focus tests, the women were asked to use the app for 1 month and then come together for a guided discussion, asking for their feedback. The feedback was generally very positive. There was some constructive feedback, which was addressed to the best of our ability before the app was released. Once the app was available for download, but prior to us promoting it, we did what is called a soft launch, in which interested prenatal care providers were asked to first review the app and provide feedback themselves, and then next to review the app, to promote the app with pregnant women and encourage them to provide feedback through the in-app survey. And this helped us to identify any issues before the app was promoted more broadly. We are now doing a province-wide rollout of the app, of which this presentation is part. And in addition, we are promoting the app through our website and social media, including having information and banners on our website, messages and paid ads on Facebook, and we had a giveaway draw for those who mentioned the app on social media. We have developed a video promoting the app, which is available on Facebook and LinkedIn, and we are also promoting the app through mainstream media. We have now sent out a press release and newspaper articles. We are putting ads in the Now newspapers and the U of S Pause page. And Tammy has done interviews with CJWW Radio, as well as CTV News, Saskatoon, and Regina. We also have promotional materials. We have posters with tearaway sheets, which are available for order. Other promotional materials we have limited quantities of, so if you're interested in receiving them, contact Tammy to see if we still have any available. So I'm just going to briefly talk to you about the features of the app. Tammy will be going into more detail on these as she goes through how to navigate the app. I just wanted to give a shout out to Krista Kaminsky, who was our perinatal infant health coordinator during much of the development of the app. And she reviewed many other prenatal apps, and through her knowledge of existing apps and discussions with pregnant women in Saskatchewan, as well as prenatal care providers, we were able to identify features that were both appealing and useful. And then through consultation with the technical developers, we determined what was realistic for our app. As you see, there is quite a long list. Still, we focused on features that would be of particular use to women in Saskatchewan. So this includes daily tips, which are short daily messages about ways women can improve the health of their pregnancy, as well as links to Saskatchewan-specific information, such as where they can get their well water tested and how to access information on Saskatchewan's maternal serum screening program. There's the monthly summaries of baby's growth and development, pregnancy timeline, which is a graphic image that shows when important prenatal tests are done. There's educational videos. We have links to these videos, which provide information about development as well as how to have a healthy pregnancy. The to-do list, which is broken down by trimester. There is Ask a Healthcare Provider, which provides the user with the ability to connect with a nurse or mental health clinician through Healthline or a pharmacist through MedSask. And then there's the more interactive features. The first is My Health, which is actually made up of 4 different interactive features within it. This includes My Weight Gain, which is a feature that tells a woman the recommended amount of weight to gain based on her pre-pregnancy BMI. And the app is able to calculate the woman's BMI if she enters information about her pre-pregnancy weight. It allows her to track her weight and see how she's doing in comparison to the recommended weight gain. There's My Mental Health, which allows a woman to screen her mental health using the Edinburgh Postnatal Depression Scale. And then it provides feedback based on what score she receives. There's My Blood Pressure, and this feature allows a woman to track her blood pressure if she's testing her blood pressure at a grocery store or pharmacy. And it provides feedback and recommendations based on the numbers that she enters. There's a kick counter, and this feature helps women to become familiar with their baby's movements. And if a doctor recommends it, this feature can be used to help track a baby's movements. There's My Pregnancy Journal, which is a woman is able to upload pictures and add text. My Resources, and this is a feature that makes this app of particular use to Saskatchewan residents. It is an interactive map with GPS capability in order to link mothers to local programs and services available in their community and throughout Saskatchewan. And finally, there is the export to PDF. And all the information that a user enters into the app can be exported into a document and saved and emailed to themselves. So now I'm going to hand the presentation back over to Tammy, who's going to talk you through how to navigate the app.
Thank you, Megan, for that great introduction. So I'll be taking us further into today's webinar on how to navigate the functions and the features of the app. So we're going to talk about getting started, first of all. So just like every other app that we have on our phones, the My Saskatchewan Pregnancy app is quite very similar to setup. So it's you just look for the app on Play Store if you're using an Android device, or on App Store if you're using an Apple device. And once you search for My Saskatchewan Pregnancy, you'll be able to download it onto your phone, and the icon should come up just like that in the second picture. So click on the app icon that you see on your phone screen, and with that you'll be able to get started by creating an account if you don't have one, and if you already have one, you'll be able to start using the app by logging in using your email and password. Just to mention that after creating an account, a policy agreement on data collection pops up for the user to accept. This privacy policy is just letting the user know that the information collected will not be used to contact or identify the user. Next, that would appear on the screen once the user has created an account is how to enter the due date. And this can be done in two different ways, either by selecting your due date if it is already known, or by using the first day of the woman's last period. So if the user already knows her due date, it's already been confirmed, the user can go right ahead and just look for the dates on the calendar by clicking over here. And if the user just found out that they were pregnant, they can do and they don't know their due date yet, they can just use the calendar to select the first day of their last period. So either ways, the app would estimate the due date, and it will appear like this in the third picture. So moving on now to the home screen of the app. The home screen typically just lists the different features and functions within the app that the user can interact with. The home screen is like the landing page of the app. It can appear slightly different depending on the device that you're using. So the first picture here shows how the home screen is laid out on an iPhone. So if you're an iPhone user, this is what the home screen will look like. It will have all the features listed side by side like that. And if you're using an Android device, it will appear slightly different. The second image is what it will look like on an Android device. Generally, the home icon would overlap with the daily tip page. So if you click on, let me just go back a bit, click on the three horizontal lines in the corner of the screen over there, you'll be able to see what the home screen looks like. Moving on now to the daily tip. The daily tip is the first function or feature of the app, and the user will most likely interact with this feature a lot because it's a daily tip. So every day the user has a new tip. So just like the name implies, and I think Megan also mentioned, the main feature here is that there's a daily message that goes along with a picture and provides health messages for the woman every day as she moves along in her pregnancy. So you have the date, for example, here shown here, the date and the messaging that goes along with it, as well as a picture. And then also you have a week-by-week tracking, the trimester of pregnancy, and the number of days to due date. For example, here it shows that the woman is in week 11, and that is in her first trimester, and that she has 209 days to go in her pregnancy. Further down, if you scroll down the page, because it's a bit longer than what it shows here, so the second half of the page is what is shown on the right. You also have the picture, like I said, that goes along with the messaging, as well as a picture that helps the woman visualize her baby's growth per time. So this picture will compare the baby's development and growth to something she can relate with, either a seed, a fruit, or a vegetable. So here it says your baby is about the size of a Brussels sprout, and then it talks about what the length and the weight should look like at this time. Coming up next after that is a monthly summary. So just like Megan mentioned, it is just a feature that describes the baby's growth and development from month to month. So it gives like a summary of the baby's growth and development. It also informs about tips and advice on what to do during this time. So for instance, in month 1 and 2, it talks about the sensitive periods of development and the impact of alcohol, smoking, and drug use, as well as the importance of keeping up a healthy lifestyle. For example, eating healthy, physical activity, etc. So also in addition to the message that goes with each month, you also have a picture of what the baby looks like in the uterus. This is a bit different from the picture that you have under daily tip. The one on the daily tip compares it to something relatable, like a fruit or vegetable, like I said. But here it really shows what the development looks like in the uterus as an embryo or as a fetus. My Health is the next feature we'll be talking about. The My Health has 4 different features under it, like Megan mentioned. So it has my mental health, my weight gain, my blood pressure, as well as the kick counter. We'll be looking at each of these features more in details in the subsequent slides. First up is my mental health. My mental health uses the Edinburgh postnatal depression scale, which is essentially a tool that helps to screen whether a woman has symptoms that are consistent with depression or anxiety in pregnancy or even during the first few months after giving birth. It's a useful tool, especially to be able to record and screen the woman, and such that the woman can share the results of this screen with a healthcare provider. So the app records this score, and the woman can have it and share with a healthcare provider, like I mentioned. The EPDS is not intended to provide a diagnosis for the woman, as we know that it is only a professional, a qualified healthcare professional that will be able to make a diagnosis. So for example, here, my mental health score here is 15. And the score doesn't just come up, it comes with information on what the screening has been able to find out from the screening test the woman has done. And it also provides information on where to get help or what to do. So everyone, no matter their score, will get suggestions for building good mental health. If the score, for example, suggests that the woman has depression or anxiety, the user is prompted to talk with a healthcare provider about how they feel. They are also provided with suggestions of things that they can do for self-care. And if the response suggests something more serious, like self-harm, the user is advised to call a helpline immediately or go to an emergency room or call a crisis service. So that is my mental health. Next is my weight gain, and this is the second feature under my health. It shows the woman the recommended amount of weight to gain based on a pre-pregnancy BMI, and allows her to track her weight by providing a graph of our actual recommended weight gain during pregnancy. So if you look here, the second picture in the middle, we have an entry of weight, and the good thing about here is that it can also be adjusted based on the kind of unit that you're familiar with or that you want your the app to record your weight in. So we have metric units, which will be in kilograms, or the imperial units, which will be in pounds. So you have the weight entry and also the dates, which can be added per time. And then over here, the third picture here on the right, you see a plot of the weight gain as the woman moves along in pregnancy. And over here, the shaded region shows the ideal or recommended weight gain trend. So we can see from this example here that the woman is slightly above recommended weight gain, although looking here, it looks like it's stabilizing. So this helps the woman to just know whether she's on track with her weight gain, and if she's also underweight, it would also show down over here. My blood pressure is the third feature under my health, and this is especially useful for women who track their blood pressure at home or maybe at a pharmacy or a grocery store, and it helps them to also keep track of their blood pressure and probably share this with their prenatal care provider. So similar to my weight gain, they can make the entries using the date, the time, recording the systolic reading as well as the diastolic reading, and that can be added day to day or depending on how frequently the woman takes her blood pressure. So on the right here we have the blood pressure readings. If you look in the back here, we have about 3 readings already. And the good thing about this is also that it tells the woman what if the blood pressure is out of range. So for example, it says here your blood pressure is very high. Wait 15 minutes while sitting and then test your blood pressure again. If your reading is still 160 over 110, you should go to the hospital immediately. So it also provides recommendation if the blood pressure reading is out of range. And the last feature under my health is the kick counter. Like Megan mentioned, this feature has kind of evolved in response to the changing understanding that we have about counting kicks in pregnancy. It is recommended now to use this feature only if it is recommended by a physician, if there is concern about the baby's movement and the physician wants the woman to monitor her baby's movement. Other than that, the woman, if she wants, can just use this feature to get familiar with her baby's movement. And it also offers tips on how to count these movements. For example, making sure to count at the same time each day, suggesting that they count in the evening because babies tend to be more active in the evening. So the woman can monitor a baby's movements per time, maybe within a certain range of time, maybe per minute or within 5 minutes, 10 minutes, etc. The next feature in the app we're talking about is the pregnancy timeline. This is just a graphic that shows different periods during pregnancy when important prenatal tests should be taken, so that women can remember to bring this up with a healthcare provider during her prenatal visits. For example, you would have different tests that should be taken at different points in pregnancies, and this runs from week 1 to the last week of pregnancy. So we have here in the middle the maternal screening test that is offered here in Saskatchewan, and it prompts the woman, if she clicks on this eye, she'll be able to find out more information about what this test is and when it should be done. We also have another one around this time, which is a nuchal translucency test. Other tests during pregnancy that are also mentioned in the pregnancy timeline include things like blood glucose screening, also taking the vaccination for pertussis later in pregnancy, etc. Another feature is the to-do list, and just like the name suggests, it's just a list of recommended things to do for each pregnancy. And the good thing about this feature is that it's interactive, so items can be added and removed by the user as they like, but we have already created like a summary of different things that we think should be done during pregnancy. We've made some suggestions for the woman, for example, when to go for an ultrasound. We have reminders about asking to be tested for STIs, reminders about starting to attend prenatal classes. We even included things that are not necessarily health related, but relevant in pregnancy. For example, preparing for the birth of the baby, thinking about baby names, shopping for baby items, preparing for maternity leave, etc. As mentioned, the lists are very interactive, so the woman can actually tailor the list to suit her needs by adding and removing items. Next, again, is the My Journal. This is also an interactive feature, and this helps the woman to keep a personalized journal about her pregnancy. It's a very good way for a woman to document different things that are happening or moments in pregnancy. And the good thing about this one is that the woman can actually add photos or pictures and add text or some information that she wants to document also in pregnancy. And the good thing about it is that it can be subsequently exported, and probably the woman can decide to save this or email it to herself or create an album or photo album or kind of journal about it. So this is what My Journal is about. The resource map is another feature of the app that makes it especially Saskatchewan specific. It's an interactive GPS map, and it informs the user about nearby local resources, programs, and prenatal services that the woman can access during pregnancy. Currently, we've added over 450 locations related to prenatal health in Saskatchewan. For example, the woman can use this feature to check out useful programs or services that are nearby. And for example, if she's traveling and she wants to look out for a certain service where she's going, she can look that up before going. It's important to mention that the services in this GPS resource map are those that are related to Saskatchewan Health Authority. So for example, you have health centers, public health offices, prenatal support programs, ultrasound facilities. The GPS map does not include services that are for private or for profit. So if a woman wants to use this, they can click on this filter icon over here on the right, and clicking that will bring out information, the type of service. So we have quite a list of services. It's not quite showing everything, but we have other locations such as blood collection centers, midwifery services, mental health and addiction services, lactation consultants, etc. And by clicking that, they'll be able to search for the type of resource or service they're interested in, and with the location. And from there, they can also get the contact information, whether a phone number, an email, as well as a link to GPS linked directions on how to get there. We update this resource map from the information that we get from service providers who tell us what is available in their community. So if you're listening to this webinar and you know aware of any service that should be in this map that is not, and it's Saskatchewan Health Authority related, we would appreciate if you tell us about this and give us information, and we'll be happy to include this information. The next feature is Ask a Healthcare Provider. And just like the name suggests, it provides links to Healthline and MedSask, which is a medication information resource here in Saskatchewan, and also informs on how to connect with a nurse, a mental health clinician, or a pharmacist. So by clicking any of this, a woman or a user will be able to connect with any of these healthcare providers, either through a website link, or maybe through a phone number by calling a phone number, or maybe through an email link. The good thing is also that we also recently added COVID-19 resources to this portion. So clicking here would also take the user to more information on COVID-19. Other features in the app include educational videos, like Megan mentioned. And this includes videos on things like trimester development, food safety, vaccine safety, labor and delivery. And then another feature is the export to PDF. Like I mentioned, different features in the app that are interactive can be exported based on the information the woman has entered into it. So we have the ability to export the journal, my pregnancy journal, The weight entries, for example, if a woman wants to follow up on her weight gain after pregnancy and she just wants to use her pre-pregnancy weight and the weight gain in pregnancy after her pregnancy, she can export that information. We also have the ability to export the blood pressure records. We also have the ability to export the to-do list items. A little more features, and then I will talk about our in-app survey. So we have a few more features that the woman can make entries into. So for example, if you click the 3 horizontal lines in the corner here of the app of the home page or the daily tip page, depending on your device, it will show you a list of different features that we've gone through, as well as a list of features on the bottom page of the app. So you have the profile. The profile is just allows the user to adjust some information that must have been imputed into the app when the woman created a profile. So if, for example, if she wants to change her name, if she wants to change her weight entries or height entry, her due date, for example, if the due date has changed for some reason, the woman will be able to do that under my profile. Information in the about just talks about the privacy policy and also some information about what the app is all about, and my Saskatchewan Prevention Institute, and of course the ability to sign out of the app. And then lastly is the feedback, which I'll talk about more. So here the user is able to give us direct feedback. So it links to a very short survey about the app if the person has feedback or comments or questions even about the app. So we encourage users to please use this feature if you have any information or any feedback to give us about the app. If you know of any of your clients that are using the app and they have some feedback on the app, we would really love to hear from them. Please encourage them to use the give us feedback feature in the app. So speaking of feedback, we decided to share a bit of feedback that we've received so far about the app. Like Megan mentioned, we've had some constructive feedback, and some of them we've been able to respond to and address. And also we had some very good feedback. So here I'll be highlighting some positive feedback that we've received. So this feedback is from a service provider, and it says, I put together a guide for my clients, Your Pregnancy app. This is such a great resource as I'm unable to run many of my programs due to the pandemic. I really appreciate all the work you guys put in for this. So this is from a service provider that works with prenatal women. Another feedback here is from a healthcare provider as well. It says, I recommend it to all my prenatal patients, and I'm thrilled to have such a great Saskatchewan-based resource. Up next is another feedback. This one is quite paraphrased from what we heard from one of our service providers as well. So she mentioned that women particularly like the fact that their baby gets compared to a fruit or vegetable because it gives them something to relate with or visualize, so they can at that point imagine how big or what the size of their baby looks like. Another feedback here is from a healthcare provider as well. It says, I'm very glad that the app has been successful. My patients have been very happy with it. Good work. So this is just a summary of the feedback we've received so far. Like I mentioned, if you have any feedback about the app, please do not hesitate to contact us. And with that, I think we've come to the end of the presentation. I would allow Megan to go ahead now.
Thank you, Tammy. Thanks for the great introduction to the app. I feel like I even know it better now. So because this is not a live recording, we don't have sort of the questions that people ask during the live recording, but I just wanted to highlight a couple that might be questions that you have yourself as a listener. So one of the questions that was raised was about the week of pregnancy. So when looking at the daily tips at the top left corner, it indicates the week of pregnancy. And it was indicated to us that this is not necessarily the same as what other prenatal apps are telling, or what a healthcare provider is telling. And we just wanted to clarify that the reason for that is that in our app, what we were telling is what week of pregnancy the person is in, whereas other apps might be telling you that, for example, if they say you are 13 weeks gestation, 3 days, our app would say you are in your 14th week of pregnancy. So it's basically a matter of semantics, but I realize it's confusing. So our plan is to put a pop-up right beside where the week of pregnancy is indicated to explain that, to explain the difference between what they might be hearing from other sources, that what we are telling them is what week of pregnancy they are in, whereas other sources might be saying you have completed this number of weeks and this number of days. So that was one of the questions that was raised. Another question that was raised was about whether the app addressed prenatal loss. And at this point, I believe it does not. It was something we struggled with a bit. So if anybody has any suggestions or feedback about how we could address that issue in the app, we would be happy to hear it. Currently, we are hoping to include at least links to some support sources that women could access if they experience prenatal loss. The one thing that's different about this app, some apps have push messages that will occur sort of ongoing. Our app does not have that, so if a person stops accessing the app, they will not receive messages from it. So if they've experienced a loss, they will not be getting messages if they choose not to go back into the app. But still, we may want to find ways to include information about how to access supports if you do experience that. So if you have suggestions, please let us know. So if you have any further questions, please reach out to us. You can contact Tammy or myself at the email address provided on the screen. You also have the ability to provide both input and either by sending us an email or by going into the app and doing the in-app survey. So if you have suggestions or feedback, we'd be happy to hear it either way. If you send it to us through an email, then of course we are able to respond to you and let you know how we plan to address that particular feedback. So I think that's it in terms of questions that have come to us. So I guess at this point, we would just like to thank all of you very much for taking the time to watch this webinar. And hopefully, if you haven't already, you will download the app and work your way through it and let us know what you think. Thank you very much.